talk about Faradic current, one of the practical for Faradic current, that is Faradism under pressure. So this Faradism under pressure, this is used whenever there is a edema in the extremities, like extremity like hand or leg, if they have swelling, edema, that is the time we are going to use Faradism. So here, why it is called Faradism under pressure? Because we are going to keep the Faradic current, then we are going to do a compression bandage for that particular extremity. That's why it is called as Faradism under pressure. So the indication is swelling in the extremities, maybe because of many reasons. So the contraindications are very similar to the Faradic current. What all Faradic current contraindications are there, everything will apply for this particular procedure. Now the materials which are required for Faradism under pressure are some compression bandages. The compression bandages comes in different sizes and different velocities or stretchabilities. So this is very thin one, very thin kind of compression bandage. Usually we use a crepe bandage. You know the crepe bandage we use for going around the ligament injury and we secure the limb. So that is the crepe bandage we use. But here we are using a porous bandage. This is also one kind of elastic compression bandage. So this comes in various sizes, like this is 4 inches, this is 6 inches, there is 8 inches available, there is 2 inches available. Depends upon the area and depends upon the person size, we are going to choose different sizes of the crepe bandages. So these are the crepe bandages for compression. Then rest of the things are like your Faradic current. You need electrodes, you need connecting leads between the machine and electrodes, you need a machine, you need either gel or water, you need the covering lids for the electrodes, and you need straps. Straps sometimes you need, sometimes you may not need. It depends upon your style of tying. So just take some covers. I will directly go into the procedure. You have to follow the protocol, like visiting the patient, communication to the patient, reading the contraindications, collecting the equipments, the performer. Now directly I will go to the technique, so I don't want to waste the time on all the aspects. The position of the patient is usually supine, okay, for when you are treating the lower extremity. It is most commonly supine, side lying or prone, but it should be in lying down position. Can you lie down? Now, the extremity which you are treating should be elevated. Okay? For example, I am treating right side, the right leg should be elevated. So I elevate the whole lower trunk. Okay? I elevate the whole lower trunk. If more elevation I needed, I elevate it further. Okay? Why elevation? Why elevation? Why it should be elevated? Huh?
To be easier on the therapist.
No, not like this.
Because lots of life.
Support.
Okay.
To let the work of muscle.
Because the treatment is for edema, swelling. Okay? So if the swelling has to decrease, then it should be towards the gravity. Okay? That is the reason the part which you are treating should be elevated. Now, so if the swelling is there in the foot and in the leg, imagine if it is there in these two areas. So first I will decrease the skin resistance. Which area muscles are there in the foot majorly? Plantar aspect muscles are there or dorsal aspect muscles are there? Where are the muscles? In the foot, where are the muscles? More muscles? Here or here? Plantar. So, I decrease the skin resistance there. I decrease the skin resistance on dorsum also. And here in the leg, the major muscles are in plantar aspect and in the lateral anterior aspect. These are the two areas, the majority of the muscles are there. So I decrease the skin resistance of these areas. Okay. Now I am going to apply electrodes and compression bandage together. So first I will take compression bandage. Sure. No? Sit down. So for him, I have elevated, but otherwise you should not do. Why? For him, I have elevated. Okay, but otherwise for the patient, you are not supposed to do this because the blood has to go towards the heart. So heart should not be in elevated position when you are doing this treatment. Okay? So the bandage, there are techniques of applying bandage. What type I am applying is called figure of 8. Figure of 8 means it goes in this way and this way. So there will be a crossing of the bandage. You take one channel of electrodes in this, which is cathode, which is anode. This is anode, red is anode, black is cathode. Okay, so this cathode, 2 layers, 1, 2, water, I apply onto the plantar aspect. Why? Active electrode, muscles are there. Inactive electrode, anode on the dorsal aspect. Okay, now I have to compress it with the compression bandage. This is only strap. So figure of 8 will go in this way. Can you see this? This is called figure of 8.
Yes. What?
Okay?
Yes, yes.
Figure of 8 bandage.
Figure of 8. تعكس عشان تطلع.
This 8 will give a good compression. Nice compression. Okay?
مرتاح
So,
أحمد.
if it is circular, it is a less compression.
Why we don't you don't use the straps?
Because I want everywhere compression. So if I put strap, then compression is only here. When I use bandage, compression is everywhere.
So the
Till here.
treatment only soiling edema.
Only edema.
Only edema.
Only edema. I'll continue. So here I'll go in circular. Here I'll go in circular.
عشان نضغطها وتنزل.
That is cathode and this is anode. So it is up to knee. Go up to the knee. Okay? So now, once this part is ready, no, it's already water. Now you have to sleep. So I will put one more pillow here. Okay? Here, whatever, to support the knee. Okay? So now the limb is elevated. your settings of electrotherapy, muscle stimulation, Faradic current, rectangular alternating. Because I am choosing 2, 1 plus 2. 2 channels I am choosing. 2. Time 30 minutes. 30.
Always.
Not always, for this. Electrodes are carbon rubber electrodes, your plate electrodes. Phase duration 1 second, because I want strong current, contraction of the muscle. Pulse interval 20 milliseconds, okay, no problem. Surge,
50 or
I need definitely surge, because this is also called as surged Faradic current, or Faradic current under surged. So surge mode on. I want alternating, that means sometimes increase, sometimes decrease, alternating. Ramp up time, because I want to increase it slowly, 10 seconds. Ramp down, hold is like this is 60 seconds is 1 minute. Okay, 60 seconds is 1 minute. You can start from anywhere 20 seconds to 1 minute, no problem. Ramp down time, again I want full ramp down time. Okay, so set. Now 2 things are set. Okay, so increase, and there will be continuous muscle contraction here and here in the muscles. I decreased because I need gel to keep actually, because it's water. This cotton will absorb the water and it will decrease the current strength. So no problem. If you put the gel, it will keep. Okay, the current will keep, because it is water. It has absorbed by the bandage. But anyway, under the electrode, direct. Now no pad after that. If you use gel, no pad. Okay, directly gel and tight electrodes.
Not cover.
No cover. When you use gel, no cover. Okay. So this is the procedure. This is for 30 minutes. Shabab, when you keep the 30 minutes like this, the patient, you can ask the patient to move. If they are able to move, like toes, ankle up and down. Okay, ankle in, out. Okay, move the toes down, up. So they have to keep on moving. When they keep on move, the muscles will work. When the muscles work, muscles will pump the blood into the blood vessels. So your current and the muscle activity, gravity, all of them together will decrease the swelling of the patients.
And use Faradic.
Huh?
Use
Faradic current. This is called Faradism under pressure. It's called as Faradism under pressure. Under pressure. Okay? Any doubts? 20 degrees. Anything just above like this is enough. If the patient is in supine. Okay? But if they are sitting, it should be more than 90 degrees of shoulder flexion. Yes, above the heart, so that the edema, the fluids will come towards the heart. So here, again, the muscles of the hand, they are more here or here? Here, okay? Here more muscles. So cathode will be inside the hand, anode will be on the dorsum of the hand. Again, in the forearm depends upon where you have more edema. Your edema more dorsum or your edema more on plantar. If it is here, then one electrode here, anode here, cathode here, or cathode here, anode here, no problem, because both the sides muscles are there, muscle groups are there majorly. So any one you can keep, but whichever side more edema, there will be the cathode. Okay? Because cathode acts in 2 ways. As I told you today's class, the edema have negatively charged ions. So when you keep cathode on the negatively charged ions, it pushes the negatively charged ions into the blood vessels, so the edema will decrease. That's why the cathode should be on the edema, whichever side it is more. So here, when you use for upper limb, again, here in the hand, you can do figure of 8, crisscross manner. Crisscross means one goes down. See here, I did one mistake purposefully. What mistake I did here? The lead of the electrode should be this side, not on the proximal side, because if you see this, the lead of the electrode is this side, so it is very easy to tie. If you see here, the lead of the electrode is this side, it becomes throughout this I have to tie the lead. So that mistake you are not supposed to do in the exams. Both the leads should be outside. Both the leads. By mistake, if it happens like this, then put the wire outside and tie it again. I'll put 2 more electrodes, anode and cathode. Whichever side more edema, that side the anode will be there. Whichever side less edema, that side, whichever side more edema, that side cathode will be there. Less edema, anode will be there.
This is Faradism
Under pressure
Under pressure.
for upper extremity. So here the settings are same.
Faradism under pressure.
The settings are not going to change. It is same. You go to Faradic current, you choose the time of the current. Whatever settings you have seen for the legs, same settings are there for upper extremity also. Okay? Any doubts? Okay. Upper lip. Even sometimes if there is edema in the arm, if I have 8 channels, okay, I have 4 channels, now 1, 2 channels, like that if I have 2 more channels, 8 electrodes, okay, then I can put 2 here, 2 here, 2 here, 2 here, electrodes, and I can tie the bandage,
Make it fast.
okay, and it will become very, very strong. Very, very strong compression therapy. So this is a Faradism for Faradism under pressure or forced surged Faradic current stimulation for decreasing edema. Okay? So remove. Technique is called as Faradic foot stimulation. Foot stimulation, or it is also called as Faradic foot bath. Okay, it is called as Faradic foot bath. So what you are going to do here is the foot muscles, here down foot muscles, you are going to stimulate the foot muscles by using Faradic current. The usual indications for this particular method is whenever there is a weakness in all the foot muscles, like after ankle twist or after fracture injury in the foot or flat foot, you know flat foot?
Yes.
You know this is arch.
Yes.
So there is no arch, flat foot.
Yes.
Okay, so straight foot. During that time, you usually stimulate the foot muscles by using this technique. Okay, so the materials which are required for this one, along with all other equipments, you require a rubber sheet. Okay, you require a plastic tub, and you require chair and some water. The water should be half of the foot. It should be till here. It should not come on the dorsum side of the foot, because we want to stimulate only foot muscles. We don't want any extra stimulation of ankle muscles and the dorsum of the foot muscles. So that is the reason the foot water should be only the mark. Can you see? This is white dark. So the marking, can you see? The water should be up to that. Okay? In the foot also, the water should be up to that. Now, we'll see how much is the water level. Can you put the foot inside? 1 foot. Yeah. Okay? Little more. If it is little less, it is okay. Here, the water. Now, we'll keep the 2 electrodes. So, where should be the cathode? Where should be the anode? This cathode. Anode. Okay. Now, where should be the cathode? Front or back of the foot?
And the muscles.
Wherever muscles are there. Good answer. So, where the more muscles? Here. Okay, here. So, here should be the cathode. Here should be the anode. Okay. So, the cathode should be in front portion. The cathode should be in the front portion under the feet. Yeah, put the feet. Little more. Good. The anode under the dorsum of the under the heel. Little more. Yes. Okay.
تحت الكعب
تحت الكعب وبعد الانود تحت الكعب.
الانود تحت الكعب.
الانود تحت الكعب.
Keep this foot also.
بريس
Just to keep the electrode in position. Not to. You don't need to. No. Because it is in the water. This is for water. This is for water. This is to keep the water. Okay? Relax. Sit down. You have seen the position? Yes. Now, some important points. Why there should be rubber sheet? Why rubber sheet under the foot? Shabab, why rubber sheet under the foot?
To give the electric.
Insulator. Okay? So even if the water leaks outside, the patient will be safe. Okay? Patient other foot also should be on the insulator. It cannot be on the floor. If it is on the floor, what happens? He'll get a shock. Okay? So be careful. Don't keep one leg down, one leg inside the water and start the machine. So both feet should be on the rubber sheet. Second important point. Rubber sheet. Any rubber, any insulator. Any insulator. Plastic, wood, no problem.
Shoes, doctor.
Shoes?
Yes.
How then stimulation will happen?
Okay, and the other foot.
It's okay, but it's better to be safe. Sometimes you have to treat both of them. When they have injury both the sides, you have to treat both of them. And one more important thing. Why the vessel should be plastic? Why can't it be metal?
To connect electric.
Okay, metal is a conductor. So if you put a metal, if you put a current, it will take the heat, it will become heat. It will be heated up. So it will pull all your electricity. So that's why it should be plastic. Okay? Why water should be at this level? Only why water should be in the feet level? Why can't it be till here?
It's become another muscle.
So it unnecessarily stimulate another muscles which we don't know. Okay? So that's why water should be only up to the border between plantar and dorsal aspect. 2 electrodes. Why cathode is front, anode is back?
Cathode for more muscles.
Okay? Wherever more muscles, their cathode should be there. Anode will complete the circuit. Clear?
Yes.
Now we'll go to the settings. You can see actual muscle contraction. Don't worry, I'll increase slowly with your permission. Okay? So electrotherapy, muscle stimulation, Faradic current, rectangular alternating. I'm using Shabab. Many times I told choose rectangular, Rectangular alternating, triangular, triangular alternating. Nobody will ask what is rectangular, what is triangular, what is rectangular alternating, what is triangular alternating.
Shape of the face.
Shape of the face, okay. What is the importance?
Strong contraction or weak contraction.
Okay, alternating is a AC current. Okay, one side rectangular is a direct current. So that is the difference. One is direct current, one is alternating current. When you keep only rectangular, it is direct current. When you keep rectangular alternating currents, it is a alternating current, AC current. So go to Faradic, rectangular alternating, 2 channels, 1 plus 2, treatment time 20 minutes to 30 minutes. Electrodes, same, carbon rubber electrodes, pulse duration 1 milliseconds. What is pulse duration? Why 1 millisecond I kept?
5 to 56.
Why 1 millisecond? I kept here 1 millisecond.
Because it's strong.
Okay, strong. The more time, the current will be in contact with the patient. If I get more here, I'll keep more, whatever possible. Pulse interval is 20 milliseconds. Why 20 milliseconds? Why not 50 milliseconds? Why not 100 milliseconds?
To stop 20
It stop and start again. Okay? So, how much our minimal time? It is okay. 10 milliseconds, 20 milliseconds, 30 milliseconds. But more interval, then the treatment time is wasted. Okay? If I keep more interval, then the treatment time for the patient will be wasted. Surge mode on, alternating, ramp up time, hold time, ramp down time, both press, right foot bath. So, what are the contraindications? Whatever contraindications which apply for Faradic current, all the contraindications will apply. One more important contraindication is open wound or the skin cracking. You know, in the feet, the cracks are very common. So, if you stimulate in that area, the patient will get a very high intensity current, and it will be really painful. Okay? So, this is about Faradic foot bath. Shabab, this is about low voltage galvanic current, or this is also called as iontophoresis. The iontophoresis means you use some medications. These medications will be pushed inside the body for decreasing the pain. Now, you have many medications. The list of medications are given in your PowerPoint, and the indications for each medication also given, and that medicine should be used under anode or cathode. That is also given in the PowerPoint, and the rationale also, why you are supposed to use it. Now here I have few medications. I will show you with one of the medications for your friend pain. You have here knee pain. Yes, can you show me the exact place? Here, this area. Any other place? Oh, laxity. Okay. Yeah. So here is the pain.
Some fluid, not here. Here maybe here inside. Deep.
Deeper inside. Here, any pain?
No, no, here.
Here, this aspect. Here and here.
Not pain here. It's the anterior cruciate.
I know, anterior cruciate, but where you are feeling the pain?
I guess so from my heart. It's deep, under.
Okay.
Not superficial.
I understand. Okay. So his problem is he has pain which is deep inside the joint because of ACL tear. So the ACL is more superficial The insertion of ACL mode superposition is here, the plantar aspect. Okay, so we'll see. I'll try to keep the electrode here and see what happens. So I am trying to use, there are many medications. This is hydrocortisone. Hydrocortisone is a steroid. Okay, hydrocortisone is a steroid which decreases pain, decreases inflammation, and decreases pain also, anti-inflammatory. This is also hydrocortisone. You see here, hydrocortisone. The company name is Ryacort, that it's okay, but the medicine inside is hydrocortisone. And you see this one, this is also in a liquid form, hydrocortisone in a liquid form. You have dexamethasone, prednisolone, hydrocortisone. These all are steroids which are used for same purpose, to decrease the inflammation and to improve the healing. Like that you have pain medications like diclofenac sodium, methyl salicylate, and you have lidocaine, lignocaine. There are many medications which are directly like painkillers. They decrease the pain in that particular area. So hydrocortisone, this is a positive ions will be released because of hydrogen, hydrocortisone. The positive ions will get released. So I will take some hydrocortisone. Usually the percentage of ointment or the medicine versus water, ointment is usually 2 to 5%. The water is 95%. So for this much amount of, this is almost 200 ml of water. So if I take 2 drops, that will be more than sufficient for the medications. So usually they won't mix it properly in the water. So it's better to inject them in the syringe and mix them properly. Or if it is a liquid, I take the liquid from this and I will put it into the water, 2 drops or 3 drops, depends upon the percentage of water I am using. So usually the percentage is 2 to 5%. And the ions, the cathode, anode, whether it is active or inactive, depends upon the medicine. If the medicine is having positive ion, then anode will become active electrode. If the medicine is negative ion, then cathode will become the active electrode. That means that electrode should be used on the painful area. Once I mix them, so I take the sponge, for example this is cathode, okay, this is anode in the constant direct current. When I use constant direct current, so I take red because I want anode, the liquid should be in the anode. So I will take this and put the medicine to only that electrode. Okay, the other electrode, I take a simple water, the normal water. The cathode, I will take a normal water. I know I don't need a medicated water. So I will take a normal water. Now this medicated one should be kept where? In the painful area. Definitely on the painful area. So wherever the pain is there, I will keep the electrode on that. Sorry. So the pain is the deeper, where just know where you have pain. So I keep one here, one on the opposite side. I'll keep 2 straps because
Okay.
I want complete attachment of the you want to move up? So the electrode is completely attached. Excessive amount of water. Keep a towel.
Can I?
Yeah, you can keep it. So now what current I have to choose? Faradic current or galvanic current? Galvanic current. Because this is low voltage galvanic stimulation. It should be interrupted or continuous? Continuous. Why? If it is interrupted, it pushes the ion till the current comes. When current stops, the ion will come back. Okay? So again, current starts, ion go, and current stops, ion will come back. So that's why I don't want that to happen. I don't want ion movement like this. I want constant ion movement inside. So that's why I want a constant direct current. Galvanic current which is constant, completely constant in nature. So the materials extra what we require here are the medicine. Sometimes instead of water I use saline because some medications are very nicely mixed in saline. Some medications are mixed in water. Some medications are mixed with warm water. Some medications are mixed with cold water. Depends upon the medicine, my type of water will change. Okay? So now here, go to... Huh? This is galvanic. Here, when you use low voltage galvanic current, the active electrode, that's what I was saying, depends upon the medicine what you are using. Okay? If you use...
we use
cathode. If it is positive ion, we use ion. For only low voltage galvanic. That is only for iontophoresis procedure. For high voltage galvanic, it is different. That practical I will teach separately. This is only for low voltage galvanic current, that too iontophoresis procedure. Here active electrode is dependent upon the medicine what you use. Go to electrotherapy. All current waveforms, galvanic current, galvanic interrupted, galvanic continuous. Galvanic continuous. So I use channel 1. Okay, channel 1. So one channel. Treatment time is usually 20 minutes. 20 minutes. Electrode selection is carbon rubber I did. Polarity positive. Yes, I want positive more. Output okay. Now start. So initially in the low voltage galvanic current, can you feel? Okay. So I have gone up to 22 milliamperes. Okay. 22 milliamperes for him. Weak still. Can I increase more? You can feel? Sure? Okay. So I have gone up to 35 milliamperes. But as per the textbook, they say anything more than 2 milliamperes to 5 milliamperes is sufficient to push the electrode inside or to push the medicine inside. Shabab, what the study says is I have gone up to 35 milliamperes. But the textbook says usually anything intensity more than 2 milliamperes up to 5 milliamperes is enough to push the medicine into the body. You don't require high intensity. That's why it is low voltage galvanic current. So low intensity, anything 2 milliamperes to 5 milliamperes is enough. And this is very important step what I am going to do now. Please remember, the chances of burn. The chances of burn are very high. What is burn? That's all. The chances of burn are very high because I am using a constant direct current. So it is very important to pour the water in between once in a 2 or 3 minutes. Okay. Same. Can I decrease the intensity? Decrease. Okay. So if it is more intensity, it doesn't make a big difference. It is not going to make a big difference because I told you 5 milliamperes is enough to push the medicine inside. What is important is safety of the patient. By keeping high voltage, if you cause a burn in that area, it is waste. So if the patient feels 5 milliamperes, it's enough to keep on the 5 milliamperes for 20 minutes. That is what is very important. And once in a 2 minutes, for the cathode, put the normal water when you use hydrocortisone. For anode, you have to put the medicated water when you press into that. Okay? Or the other side is anode. This one is cathode, black one. This is anode. But for here, the anode is the major electrode for hydrocortisone. Okay, like this, if you keep it for 20 minutes, the pain is going to decrease. So any doubts in iontophoresis? I'll keep it for some time till we take the attendance. There is another practical for high voltage pulsed galvanic current that I will teach you in the next week with the other currents. About frequency, mode of the current, intensity, duration. First one, the Faradism under pressure. The mode of the current is Faradic current, is alternating current, Faradic current, alternating current, and with a full surge. The surge of the current should be maximum so that you will get a good maximal contraction. That is mode. The intensity of the current is usually patient dependent, but you should be able to see a visual muscle contraction. Okay, that is the intensity. Duration of stimulation is usually 20 to 30 minutes. Frequency of stimulation every day. You can treat it every day. That is about Faradism under pressure. For Faradic foot bath, the mode of the current, again Faradic current with full surge, with good amount of muscle contraction should come. That is the mode of the current. The intensity of the current, where you can see a movement in the feet, in the water. Okay, the feet should be relaxed, up, relax and up. So this much amount of intensity is required. Again, it is patient dependent. Then frequency is usually again every day. Then the duration of the treatment is 20 minutes to 30 minutes. For galvanic current, for iontophoresis, the mode of the current is constant direct galvanic current. That is the mode of the current. Constant direct galvanic current. There is no other current which you can use for iontophoresis. Second, the intensity of the treatment 2 milliamperes to 5 milliamperes is sufficient. If it is more, then it may produce a reaction like this. Can you open? Can you see? This happened because of more intensity. This is arrhythmia reaction, no problem, not going to affect any patient problem, and the patient is telling it is some itching, burning here, and we are keep on pouring the water. The intensity was around 15 to 20 milliamperes. Okay?
It did it.
So here it did not happen, but cathode is a stronger
Yes,
electrode than the anode, so that's why it happened under the cathode. But still it is a problem. If it is more than this, it may cause burn in that particular area. Okay? So that's why the intensity in iontophoresis is 2 milliamperes to 5 milliamperes. Just to check the patient whether current is not coming or not coming, you can increase. The patient will tell current is coming, then decrease up to again 5 milliamperes. Okay? Enough. 2 to 5 milliamperes of intensity is enough to push the medication into the body. That is intensity.
Okay.
Frequency. Alternative day. Not every day usually. Alternative day because some drugs will have some adverse effects. So to decrease the effect of the drug, we need to wait for 24 hours to 48 hours. So that's why you wait for 1 or 2 days, then again you give the treatment. That is about frequency of your treatment. Duration, minimum is 20 minutes, maximum it can go up to 1 hour. As the time increases, the intensity has to decrease. It is inversely proportional. Time increases, intensity decreases. Time decreases, intensity increases. And it is up to maximum between 2 milliamperes to 5 milliamperes. That's it. Okay? So that is about